Hello, I'm Stephen Tolan, an orthopedic sports medicine surgeon with the Steadman Hawkins Clinic of the Carolinas, part of the Greenville Hospital System University Medical Center. I wanted to talk to you today about disorders of the biceps tendon at the elbow joint. The biceps tendon turns into a single tendon, and then this inserts into the elbow, and the function of this is to allow flexion of the elbow and also to allow supination of the elbow. The biceps at the elbow is usually injured by a single traumatic event, such as pulling on a heavy table or pulling on a heavy weight, and the weight actually pulls against the elbow. This can either partially tear or completely tear the biceps tendon from its insertion at the elbow. If this biceps tendon tears completely, it will migrate or move up the arm, and there'll be a noticeable difference between the appearance of the biceps muscle on one side compared to the other. Also, swelling and bruising will occur in the upper part of the forearm. You may also notice that you can't feel the discrete tendon itself that was there in the elbow prior to the rupture. Partial tears of the biceps tendon occur with the same type of injury, but the tendon doesn't pull all the way loose from the bone. A lot of times these will heal on their own, but sometimes may require further treatment, especially if the tear involves more than half of the tendon insertion. With the complete tears and with the partial tears, these can be detected by clinical exam. An MRI scan may also be obtained to confirm the diagnosis. If the biceps tendon is completely pulled off of its insertion on the elbow, we would typically recommend surgical fixation to try and restore the strength to the elbow. Sometimes conservative treatment can be performed if there's not as much demand on the elbow or if the patient is elderly. Typically with the surgical treatment, this can be done by making a small incision at the elbow, finding the torn part of the tendon, and then making a small socket in the bone and then reattaching the tendon back to the bone. If it's a partial tear that's remained symptomatic, sometimes we have to detach the tendon and then reattach it in a similar manner to get it to heal. Once it's been reattached, it needs to grow back onto the bone. This process usually takes 2 to 3 months. During that time, the arm will be protected with some type of a splint, and gradual physical therapy will be instituted to allow restoration of the range of motion to the elbow. Once fully healed, at approximately the 3 to 4 month period, normal activities can be resumed. Heavy lifting can be resumed more around the 4 to 6 month period. Thank you.